Hey, John, don't you think we've talked quite enough about the COVID-19 pandemic and all the healthcare and business policy implications? What is left to talk about anyway?
Whoa, wait a second. What about the epidemic of mental health issues at a time of this pandemic? What about talking about that?
Welcome to CareTalk, America's home for insightful debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
John, let's talk today about how the pandemic has affected mental health and substance abuse. What's happening?
Well, let's first start with the fact that we're talking about it. And one of the biggest challenges, the biggest fears I have having in healthcare is people don't talk enough about the hard issue of mental health. But if you look at just the pandemic, David, between March and July, you almost have a doubling of people who admit to being affected. Their mental health is being affected by the pandemic. You'd expect that it might have gone down over time, but it's actually getting worse. And if people are willing to talk about that, imagine all the things they're not willing to talk about. I mean, just Salesforce.com, one of the most successful companies in America, 37% of its employees admit to being challenged by a mental health issue. I think that we've had a shadow epidemic that is turning into a real epidemic because of the pandemic.
John, the numbers are staggering, John. You know, as you're saying, over a third of adults are reporting anxiety and depression during the pandemic. It's going up, not going down. Like about 1 in 7 people said that they have started abusing substances or increased their use of them to manage the stress, and more than 1 in 10 are reporting thoughts about suicide. So I think it's a devastating number. I also want to point out though that there are some countervailing pieces. So amidst all the troubles, families are getting together. Whoa, what? I'm not allowed to say good news? This is the bad news only?
You keep going.
No, you keep going.
I think that we have to be able to raise these issues. And I think one of the biggest issues has got to be access. I've got to think that all of the conventional ways that people have to access help during this stressful time, have got to be harder. I don't see the good here. What do you see?
I want to see some good, John. I'll roll two of my answers in here. So first of all, you actually have families getting together. You've got some less stress because you don't have the commute. You can stay away from your toxic managers and coworkers.
Wait, too close to home.
Yeah, well, I mean, the average person. And then there's less of a chance for people to get started with drugs. So dispensaries shut down for a time. There's less peer pressure to start vaping. And it gives people a chance to step back and to address kind of the mental health and substance abuse issues, do it better after the pandemic.
You are digging deep to try to find something good here. I think we've got to address the fact that even before the pandemic, there's not enough access to digital, human, and covered benefits where people could access decent resources. We know that cognitive behavioral therapy works, that we have drugs for depression and anxiety. We've got solutions. We have to make them more accessible. And your answer is families coming together. Yeah, that's good. But I think this problem is big and getting bigger until we can come up with a solution to this pandemic. I mean, what do you think the impact of the lockdown is?
Well, the lockdown has been tough, John, but you're not letting me answer in previous questions. So access, I think, is definitely a problem. It's a huge problem beforehand. One of the things that the pandemic does is, in moving toward telehealth in general, it enables us to consider mental health to be done on a telehealth basis and to bring in some digital solutions and maybe expanding access in that way. So I'm not so negative about that.
That's fair. And I think you look at in the state of Massachusetts where you live, the People's Republic.
Commonwealth, John, not a state.
It's a People's Republic. That the Blue Cross Blue Shield plan is actually equalized and has really immediately gotten to parity for in-person and telebehavioral health visits. That's a huge step forward. And I think if we can change the reimbursement, we might change the coverage. And it can't just be for this pandemic. But I think that's been helpful. I hope the door is open to more digital first solutions. Like, I don't know whether you've seen that great company Workit, where they actually, it's addiction and addiction recovery that is digital first, because there's been historically a real desire for the healthcare system to control access to mental health, which has shrunk an already limited system. and limited to even fewer people. I'm hoping these things, the reimbursement changes you're talking about and the new digital startups in this behavioral area actually continue to get support. That's how we would actually create some solutions. I'm really concerned here.
Well, John, I think one of the fun things about these digital solutions is their names. So you mentioned some. There's also one called Amy, and there's one called, I love this one, Wobot.
Well, that was probably a bad fundraising idea.
But listen, John, you also ask about, you're jumping all around here. I think, you asked about the lockdowns. The lockdowns are pretty bad. Some of the terminology itself, I think, is problematic. Lockdown, sheltering in place, social distancing. I mean, these are all sort of like the most negative things that you could say.
What would you want? Extreme family meetings?
I would call it, relax in place, and say goodbye to your boss day, that kind of thing.
Stuck in your place, no travel. I mean, what are you talking about?
Yeah. So I do think that some of the, actually we should be more careful about the terminology. When I hear about these things, it really sound like you're under siege, and I think it's problematic. So some friendlier terms, I think, would be a good place to begin. John, I'd like to, we're talking a little bit in general here.
I've heard of fake news. That sounds like fake words.
No, John, it's euphemisms, I think, is the term for it. Is that euphemisms? What does that start with? A U? So, John, let's talk about how this affects people of different ages. So we talk about older people. They're obviously affected in one way or the other. Families that have school-age kids themselves, the disabled, people with mental health issues. I mean, how does it affect different kind of people?
I think I go back to the notion that we don't talk enough about mental health, that mental health is a huge line of correlated challenge that drives up hospitalizations, healthcare, emergency room visits, and challenges at home. So let's start with the fact that we don't diagnose and treat enough people. Then you throw in the pandemic where you restrict or remove the access you've had. And I've got to think it will extend and worsen the isolation that seniors are already feeling, or people in difficult relationships are already feeling. And I've got to think it's also really disruptive to kids' happiness and socialization. But I don't think we should be focused as much on the list of things that are going wrong, because I think this is going wrong everywhere, David. I mean, you're happy with these extreme family meetings and the fact that you don't have to travel to meet people like me, but I mean, people are suffering out there.
Well, John, there's no doubt about it. And I think for older people, the isolation and loneliness is a big issue. You think about people that have been in a nursing home, and of course, our bias is to keep people in their own home. But in addition to the kind of their physical health concerns and pains and disability, the fact that you can't actually visit people and they're really isolated physically is a problem.
Well, and I don't know whether you've seen the statistics, but just isolation alone, people who self-acknowledge loneliness, which is a large and growing phenomenon before we got to this pandemic, which had sort of enforced loneliness. Those who say that they are suffering the equivalent physically, the equivalent of smoking a pack of cigarettes a day. And that gives you a sense of not just the dollar cost of all of that healthcare, but the pain that people are feeling and the genuine physical result. If you extend that loneliness beyond the frail and isolated elderly across society, I think we're going to be paying a lot more healthcare bills. And again, my fear is we're not going to be dealing with the root cause.
Yeah.
And I don't know whether calling it something other than loneliness. What would you call it? I mean, like, you're the one with the new words.
I was going to use some, words like isolation, feeling disconnected, that kind of thing. I mean, if you consider also from kids' standpoint, they've also got a kind of a loss of social contacts. Ideally, initially they love it, can sleep in and can just be on the phone, but they lose that, in-person social contacts. Some kids are in abusive settings, food insecurity. So, those are major stresses that are going to have a lifetime of an impact. And then you can't forget the fact that COVID itself can actually probably, if someone who gets COVID can end up with mental health issues down the line, either because when they have a resurgence of physical symptoms, that can also lead to mental health problems, or even apparently the inflammation from getting COVID could make it more likely to get certain mental illnesses later on. So,
Just think about it, David. If you've got COVID, you're effectively going through a traumatic episode. So I wouldn't be surprising if many of those folks are dealing with PTSD. And I also worry about the burden on essential workers. I know that one of the things that I saw was interesting is we started to really make a lot more accessible telebehavioral health for essential and frontline healthcare workers, which I think is absolutely critical. But I think this all comes back to, are we willing to acknowledge this as a problem? Are we willing to put some dollars behind it? And are we going to be flexible about how people can access it? Because we can solve these problems.
So John, just to talk about how widespread this is, there was a TV show back in the Stone Ages that you and I used to watch, and they used to say, "Kids are people too." Remember that one? I won't sing it for you, but I saw that even zoo animals are experiencing depression as a result of COVID. The zookeepers are noticing this and trying to take steps there.
You're really focused on the irrelevant here, dude. But it wouldn't surprise me that social animals like gorillas and others would be concerned. But I think I'm focused on the people you can take the zoos.
Okay, John, let's talk about technology. We were talking before about some fun names of things like Wobot. Now, I saw there's what they call this autonomous, culturally competent robot called Pepper. And that's in development, and it's supposed to interact with people in nursing homes and make them feel
well, we're not going to use you as a model because we have to have a robot that's empathetic.
Right.
But I do think that if you think about a system that's shrunk and underfunded, that the fact that I wouldn't be so skeptical of the digital solutions, not just digital first access like WorkIt, but the text chat treatment tools like Wobot, the access to meditation apps like Waking Up with Sam Harris or Headspace. I think what's remarkable and hasn't necessarily been reimbursed or been accessed is the range of tools that either a professional can use that could replace or support a professional like Amy, the AI therapist, or the broad range of understanding that mindfulness and meditation apps, access to those kind of therapies at a very low cost or no cost, can actually help people get through it. So I think there's actually a revolution there that's sort of exciting, as long as we can avoid the kind of the shaming and blaming that some folks like that guy for Barstool Sports is doing to kind of to sort of make fun of what's of the most vulnerable among us. I mean, I was embarrassed by that. That's awful.
Yeah, John, you're talking about Skip Bayless and him giving Dak Prescott a hard time because he was soft, revealing that he had depression after his brother committed suicide. So
what a jerk!
Yeah,
just unacceptable.
I don't want to get us into the NC-17 ratings here with those words you want to say, but I know what you're talking about.
But you look at
folks,
courageous folks like Charlemagne the God and others. Some professional athletes who've leaned in the NFL and the NBA and said, "I own this problem. You can own it too. We can solve it." It's just shameful what he did, and it's unacceptable at a time when we're trying to get people to have a conversation, and that's where this starts. It's appalling. We've got to turn around the conversation. That's where we need to get right now, and the pandemic makes it more acute than ever.
John, it's also we always like to try to inject a little humor here. My son, who was a little stressed out by the pandemic, decided to use one of those inspirational posters, that you see sometimes around the office. And this one says sanity, and it says minds are like parachutes, and it says just because you've lost yours doesn't mean you can borrow mine. So that's
yeah, great. That's really funny. I think quite the opposite, that we have to all be sharing and supporting others. But David, come on, why don't you come up with some ideas? You're the one who thinks that you acknowledge that things aren't going great. What else should we be doing?
Well, John, I have an idea, which is, I said we're going to talk about substance abuse a little bit. One problem is the increased use of substances, and one policy I think we should focus on is actually the rollback of the legalization of recreational marijuana. There's a move to legalize it at the federal level called the MORE Act. I think it should be called the Bong Hit Act. And I think that should be, we should have some pushback on that, because I think we're gonna look back a decade from now and say, gee, we went too quickly on legalizing marijuana, and look at all the problems that we have. That's one idea.
We can absolutely control it. There's no reason to unleash another addictive substance and make it more accessible. We're doing a massive social experiment in the States. We should at least figure out what the impact is there at a time when addictive behaviors are going up. I agree.
And John, my other thought is, this is September, it's Suicide Prevention Month. There's all sorts of things people can do in terms of reducing suicides, asking people about their feelings, being there for them, keeping people safe, and help them stay connected over time. There's a proposal to have a national 988 phone number for suicide hotline. I think that would be a good idea as well. So keeping it real, keeping it specific, John. That's my thought.
Well, I think you've got crisis text line. There are, if people are lonely and desperate, there are solutions out there. There are people who want to help. And I also think we've got to start thinking about, again, if we're going to take this seriously, behavioral access to mental health, access to these tools have got to be integrated into healthcare in general. It shouldn't be segregated, paid differently. The Parity Act, which was passed a bunch of years ago with our friend Patrick Kennedy, is still not enforced or supported by insurance companies. It's underregulated and supported. We need to make sure that access is there, because if we pay for care, we'll get more care, and that care and support for people in need will pay off tenfold in terms of a better society and lower healthcare costs.
John, I find it's been very therapeutic speaking with you today on this episode of CareTalk, and I would suggest we wrap up our session here. I'm David Williams, President of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Thanks for listening.